Welcome to Surviving Bad, where we explore stories of survival, hope, and inspiration. Today we have some important Iowans joining us to talk about the opioid crisis. Sarah from the Iowa Healthcare Collaborative, Janet from the Department of Public Health, and Dale from the Iowa Office of Drug Control Policy. They are all a part of Iowa's front line in the fight against the opioid and heroin epidemic. Let's start with Sarah from the Iowa Healthcare Collaborative. Sarah, welcome. That was a mouthful. Healthcare Collaborative. Tell us about what you do and what the Healthcare Collaborative is.
Absolutely. So I am with the Iowa Healthcare Collaborative, or IHC for short. We are really a patient-centered, provider-driven collaborative, and we're a nonprofit. So we actually really work hard to advance healthcare in Iowa. We are working closely with multiple other states as well with some of our initiatives. So we have a hospital initiative, we have a clinic initiative, as well as an initiative in the communities right now. We cover the entire state of Iowa. So we have 150 hospitals in our hospital initiative, about 80 or 90 clinics in our clinics, and then communities, we cover 7 big communities or kind of counties throughout the state of Iowa.
Now, the opioid crisis has really unleashed a lot of new forces in the whole healthcare thing. I mean, we know that hospitals, emergency clinics are really on the front line along with first responders for the overdose events and the reactions people have to various drug and substance abuse poisoning issues, whether it's marijuana, opioids, heroin, or whatever. It's got to be a lot tougher from public relations point of view when the whole healthcare system is sort of looked at as part of the problem. Absolutely. What are you finding is the case in Iowa? What do you communicate with people to sort of clarify that situation?
When we're out in the communities talking with either the communities or healthcare providers, I really walk through a timeline of how we got to where we are today. So looking at where the WHO said that, the World Health Organization said that opioids are not addictive back in the 1950s, going into the 70s and 80s where we started to see some of this opioid phobia, where physicians were worried about prescribing. They didn't really know what these were. And getting into the 80s and 90s where we started to see more prescribing, new medications coming out. And then from there, we even saw healthcare quality, and the physician's quality of care was linked to pain. And so then we saw pain as the 5th vital sign in the 2000s, and that's where we really saw the epidemic ramp up. So the way I approach that when people ask kind of who's to blame, who caused this epidemic, it's really all of healthcare. It's not just the physicians, not just the pharmacists, not just pharmaceutical companies, not just the associations that said these were non-addictive, but all of healthcare is the ones that had this happen. So now we need to take a step back and see how we can help with this crisis.
I know that we've had guests on the show that referred to the problem as one that also has some context with people believing that pills should perform miracles. Mm-hmm. And especially with pain, and we've had doctors on the show that have said pain is not always essentially curable.
Absolutely.
Is this climate affecting relationships with patients? I mean, if people have a valid issue with pain, how is that changing based on this opioid crisis and your work with the collaborative?
So what we're doing at the collaborative through our opioid guardianship project is actually looking at comfort and functionality versus pain. And what we found is if I ask a patient, how much pain are you in? They will do a full body scan and say, oh, you know, my head kind of hurts, my back kind of hurts today. I'm probably around a 4. If I ask them, how comfortable are you? They're more likely to say, I'm actually pretty comfortable today. And so that's really what it's called is balance framing. So changing it from a negative perspective to a positive perspective on pain and removing the word pain that has such a negative connotation, but talking about comfort and functionality. And so we've actually developed a comfort scale that's very similar to the pain scale, but looks at comfort instead, as well as a comfort menu that patients can have while they're in the hospital to pick out what makes them comfortable. So for example, a lot of patients don't know that they can get an extra pillow, a toothbrush when they're inpatient to make them feel a little bit better. So we have some of those items on there. And then lastly, we've created a comfort plan to send them home with so that they know what they're taking, why they're taking it, and that has some questions for them to ask their primary care providers around, when should I stop taking this medication? Where can I dispose of this medication? Because patients don't know that information, and they shouldn't have to know that right away. Healthcare needs to help them with that. So that's really our work, is trying to change the way we're talking about pain. Instead of talking about pain, let's talk about how functional are you? Can you get dressed in the morning? Can you go down to the mailbox? Can you go to your daughter's soccer games? Those are really the important pieces that we're working with providers to start changing that conversation.
Tricky question, but is there really more pain in the world today, or do people just expect somebody else to help them with it instead of coping with it?
I think you got it kind of right on the head there, the nail on the head. It's really more we're having issues with coping with it. We're seeing more that patients expect to be down to a 0, whereas in the past you wouldn't necessarily expect to be at a 0. Some pain is a good thing. It tells your body, if you had surgery, that you shouldn't be doing too much so that you end up ripping stitches. Some pain can tell your body exactly what it needs to do. So expecting a scale of 0 for pain is something that I think our culture has shifted to expecting to be at 0. And so changing that conversation, I think, can help us reduce pain or reduce the amount of opioids being used, or using other items to help with pain, such as aromatherapy or physical therapy, those sort of things.
But please let me know if I'm wrong. This seems to be something I'm trying to understand myself. You have the cause of pain, which is, say, over here, and then you have a pain medication. It doesn't really affect the cause of pain. It affects the spot in the middle called your brain that sends the signal of pain to you. So
Correct.
Even if you use a lot of these pain medications and change the signal, the real pain is still in your body, the real cause of that pain, so it's not curing anything at all.
Right, right. And it does affect your brain by telling your brain that it can block that pain, so you don't feel that pain. The problem with opioids is that one of their side effects is actually increasing the level of pain that you have. So the longer that you're on them, the more receptors pop up in your brain, and the more opioids you need to block those receptors to not feel that pain. So you actually get that higher level of pain.
So the opioids actually can be part of the problem.
Absolutely.
Thank you very much for sharing. When we return, we'll talk with Janet and Dale about the challenges Iowa faces with the problem that affects both rural and urban Iowans. You don't want to miss this.
Kids go through phases, but Jeremy went through painkillers, bottles of vodka, and his mom's purse when he needed more. The story of addiction is all too familiar, but you can change it.
Don't forget to tip him.
I know, Mom. I know.
If you or someone you know is in recovery from addiction, share your story with the partnership at drugfree.org, because your story can change someone else's.
Sharing. I mean, I don't mind it when there's enough to go around. Toys with Charlie? Okay. My mint ice cream? Fine. Our slow internet with my whole family at the same time? That's pushing a man too far.
Drop the phony internet and get a real deal. Add Mediacom Internet 60 for just $14.99 a month for a year. Call today.
Right through there.
You have to help her! Help her!
Hey, Sam, can you hear me? Looks like an overdose. Do you know what she was taking?
She doesn't do drugs. Her friends don't do drugs.
No, we're just trying to save your daughter's life. Any idea?
Go to the movies, hon. See you later.
Bye, Sam. Sam, wake up!
Welcome back. We're talking about the opioid crisis in Iowa, and joining us are Dale Woolery from the Iowa Office of Drug Control Policy and Janet Nelson from the Iowa Department of Public Health. Dale, let's start with a look at what's happening in Iowa in terms of policy and legislation that's really going to affect Iowans, because I know there's been a lot of energy invested in that this year.
I think Iowa lawmakers are hearing loudly and frequently from constituents across the state that the opioid problem has gotten worse and more needs to be done. It's not all about legislation, but legislation will most likely be a part of the response. And so we see several bills that have been introduced and are currently being debated at the State House. There's one that is comprehensive, or the most comprehensive in nature. It's House File 2377. It is passed unanimously out of the House. It's now in the Senate. And so far, there's not been a vote against it. It has 13 different parts to enhance things like the prescription monitoring program, to deal with prescriber accountability on opioids, and to create a Good Samaritan law, which would encourage or incentivize the reporting of overdoses to try and save lives. So there's a lot going on at the State House right now, and I think it's indicative, or at least illustrative, of the epidemic and how it's starting to hit the state of Iowa and move across the state.
Yep, and that's good to hear that there's some legislation, but we also know that legislation primarily goes after the problem, doesn't do as much before the problem occurs. And that's why we have Janet here from Public Health, because at the same time we're doing these things to react to the problem, we have to be proactive about prevention and getting out into the communities with these messages. Because as I heard it, it's the worst of it's yet to come in Iowa. That the epidemic, in a sense, is moving across the country, and we're starting to see an increased incidence of these problems that we're trying to deal with. What do you do at your office that's helping deal with opioids?
I am with the Bureau of Substance Abuse Prevention with the Iowa Department of Public Health, and we have several grants and programs throughout the department and also throughout treatment that are providing different resources and presentations and training throughout the state to law enforcement and healthcare providers, and we're just providing education.
Now, we know it's hard in Iowa to provide services to rural communities, and that they're getting hit pretty hard by some of these problems too. How is public health in Iowa adapting to some of those demands when it's harder to get there and it takes more resources?
Well, we've got 18 agencies, prevention agencies, that are serving all 99 counties in Iowa, including the most rural parts. And what we're doing to really spread awareness is we're working with coalitions. We're getting community involvement, because that's what prevention is. It's education and community involvement, and it works. So by getting coalitions together throughout these communities, then we're able to spread the word and just increase the stakeholder awareness and have people help throughout the communities and throughout the rural areas.
Now, what are you hearing, not just the good stuff, but what are you hearing about the challenges people are facing in Iowa, the people that are dealing with these crises in their families and communities and homes, and what effect are they having on what your work does?
I think a large part of it is stigma. People do not want to be stigmatized that opioids are really, it's a problem that really drug abusers have, but it's really something that can affect anyone. And so our prevention department is working to really spread awareness that it can affect anyone, and we're trying to provide resources such as the Your Life Iowa website, and that has resources on drugs, alcohol, and gambling, and also suicide prevention. And so people can go there, and on there's a treatment locator. So if someone is in need of treatment or knows someone who needs treatment, they can just plug in their information, a zip code, and it directs them to the nearest treatment agency that can help them.
So that's an important point, that it's not just the stigma with opioid medications. We're still dealing with alcohol, meth, marijuana, and all kinds of other illegal substances that are affecting our communities. Is this something also falls under the umbrella of what you're doing?
Yes, everything with prevention falls under the umbrella of our department. And so we're working together collaboratively to make sure that all of the substance abuse issues in Iowa are addressed.
Thank you very much, and thank you, Dale. Thank you for sharing. We come back from the break, we'll take a closer look at what's happening in communities around Iowa. See you then.
You may have heard about synthetic drugs in the news and the fact that more Iowa teenagers who use them are ending up in the hospital. Synthetic drugs can be dangerous, but you can help prevent the threat. Learn about synthetic drugs and talk with your kids now. For sale does not mean safe to use.
Get help at drugfreeiowa.org.
Right through there.
You have to help her. Help her.
Hey, Sam, can you hear me? Looks like an overdose. Do you know what she was taking?
She doesn't do drugs. Her friends don't do drugs.
No, we're just trying to save your daughter's life. Any idea?
Going to the movies, hon. See you later.
Bye, Sam. Sam, wake up.
So who's going to do what?
I'll pack the dead batteries.
Great.
I'll only put what I don't need into a duffel bag.
Perfect. That's totally unhelpful.
No problem.
Meanwhile, I will try to comfort everyone by speaking in a calm voice. And who is going to handle supplies?
I can forget to do a list for us.
Thanks, pal.
We couldn't be any less prepared. I'm proud of you guys.
Talk to your kids about who to call, where to meet, what to pack. Visit ready.gov/kids for tips and information.
Welcome back to Surviving Bad. We're with Sarah, Janet, and Dale, and we're talking about the opioid epidemic in Iowa. It's not just in the news, it's actually in every Iowa community. Join us as we continue the conversation. Dale, welcome back.
Thank you.
You know, you get to sit at the Capitol a lot and sort of see all the people come in, the constituents that are looking for help, and you see the legislators struggle with how to do stuff. And you know, what's your sort of feedback to people in Iowa on what you think people need to know, how all these things correlate that we're talking about today?
I see this as a complex and shared problem that's not going to be easy to solve, but I think it's going to take a shared response. Medical professionals, it's also going to be legislation, education, it's going to be intervention, naloxone and referrals to treatment, medication-assisted treatment. It's going to be enforcement, especially with newer illicit opioids being smuggled in, and now we have more people using heroin and other illegal forms of opioids. But I think what all of us can do is take more personal responsibility. As a doctor in Des Moines told me, we need to respect our medicines, do a better job of respecting our medicines. So I think all of us have some things we can do to make sure that we're using medications as instructed, period, that we are safely monitoring and storing them, and then when we no longer need them or they're basically out of date, we need to get rid of them, properly dispose of them through take-back sites and so forth. And that's, I think, part of the solution, and that's kind of at the foundation of everything else as I view it.
Well, thank you very much. Sarah, question for you. There's a good chance that as we wean people from opioids, some of our population is going to end up with problems with heroin. We know this is happening. What's the position your collaborative has on dealing with that outcome?
A lot of what we are doing is actually around education in our communities about that exact issue. You can start on an opioid and then move into using heroin just based on the way that things work, and it can happen to anybody. So that's through our education program. We actually get out in the communities, talk to not only healthcare providers, but also the communities, and we've created a PowerPoint slide deck that we can actually share with any healthcare provider across the state, with scripting and with some training that they can go out into their community and educate around that piece. So we are aware it's happening, and I think education is going to be the big part that we will play going forward with that, as well as doing webinars for our healthcare providers so that they know what is coming, what's currently happening, and how can they work with the community to help educate and help them prevent having a heroin issue continue to arise.
So it's been a big learning curve for everybody. Now we come to Janet. Now you have all these outcomes in public health. If we do a great job in reducing the use of opioids, we have a lot of people that are accidental addicts. They've made a choice or a relationship with a doctor in some way, ended up taking a drug that's taking them over. Now they have something that we can construe as an illness called addiction. And if they don't get their medicines, they may look for other alternatives. What are you doing to help deal with some of those potentials and to help Iowans out?
Well, the key, as Sarah and Dale said, is really education and really getting community involvement and spreading awareness about what the issue is and how they can get help. And there's several resources out there. Our prevention agencies are giving presentations on prescription drug misuse and drug trends, and then also they're giving training to healthcare providers on how they can utilize the prescription monitoring program and how important it is and how to refer to it before they prescribe opioids. So then they can help people and identify problems if someone is already addicted or they see a problem with opioid use. So there's a lot of education out there that we're presenting out to the communities, and we want to make sure that everyone is aware and also aware of the different treatment services that are available throughout the state. And people can find that treatment and assistance through the yourlifeiowa.org website.
Yeah, and that's a good thing to provide those resources. Because one of the things that we've noticed is that even though opioids are really tremendously deadly, I mean, over 60,000 Americans died last year, Iowans are going to die, there's been a rather large problem in the whole country with substance abuse, including alcohol. Mm-hmm. And what do you think are some of the reasons that we continue to have problems, that we can't just sort of stop doing things that hurt ourselves?
I think it's probably, again, education, and people think that, well, if a prescription drug is prescribed, then it's okay, it's safe to use, so they go ahead and use it and experiment with it, and then it leads to or just escalates to additional problems. Alcohol also, that's seen as a legal, it's been legal, so why not use it? It's not going to hurt me or my kids. I did it when I was young, so it's okay if my kids do it. So it's just, we need to build awareness and let people know that it is a problem and to try to put a stop to it as soon as possible and just let them know that there are repercussions to misusing drugs.
Yeah, what we're seeing is that the connection and the pathology with all of these addictions have a lot in common, and that the opioids, because they cross a lot of socioeconomic barriers, have made more people aware that addiction's a big, big issue. After a short break, we'll invite our guests to share their final comments and some good advice with you. You don't want to miss this. It may help someone or even save the life of someone you love. See you after the break. Children see magic in the world around them, and parents see the dangers.
There is hope for the future if we face it together.
Find out more about how you can protect your children from the risks of illegal drugs, prescription medications, and alcohol.
Go to drugfreeiowa.org.
My mom thinks hashtags are something you eat with eggs. She legit has a meltdown every time her phone updates. Last week, she asked me to explain chat snap. So of course, she chose the absolute wrong internet provider, and now we have the slowest internet ever.
Escape Planet Slow and get a real deal. Add Mediacom Internet 60 for just $14.99 a month for a year. Call today.
You wouldn't walk through the halls of your school naked, yet without thinking. Many teens sext explicit photos of themselves to friends using cell phones, never thinking it'll go further. But once you hit send, you're exposed. You're out there in cyberspace for everyone to see. Sexting, it's dumb, it's dangerous, and it's against the law.
Watching your sister go through withdrawal is the last thing you expect to do. You hope she gets past it, but worry she'll relapse. The story of addiction is all too familiar, but you can change it.
That's 2 out of 3.
If you or someone you know is in recovery from addiction, share your story with the partnership at drugfree.org, because your story can change someone else's.
Welcome back to Surviving Bad, and we're tackling a major problem in Iowa today, the opioid crisis. We can't fix the problem with the time we have here, but we can offer some advice that may help you save a life, maybe your own. We're going to see what our experts have to say, and I'm going to be the guinea pig. I'm going to ask them what they would say if I was their friend or a member of their family and they thought I had a problem with opioid addiction. Janet, let's start with you.
Peter, I think first thing is that I want to get you help. I want to intervene by finding a treatment that will help and assist you in helping with the issues that you are involved with.
Is it that easy?
No.
No, it's not, is it?
It isn't.
Because I'd
There's a lot
probably
of
be boiling
denial,
over.
and
Yeah.
there's a lot of denial, and then it's also people are scared, and again, it's just not something that they want to face. So I think having parents involved and just letting people know that there is help out there, and then also just making the call and just being supportive of the person, and just letting them know that there is help, that it's could be a long haul, but if they keep at it, then change will happen, and they will turn around, and things will be good.
All right, Dale, we're golf buddies. You sort of sense I have a problem. I had a knee surgery. I've been taking these pills, and halfway through the round, I'm saying, I better take a pill. My knee hurts. What do you say? What do you do?
Well, I think first and foremost, I want you to know that I'm going to be there as your friend in support. And if for a family member, make sure they know you love them and that you're going to walk with them through this process. I'm not an expert on treatment. I think the other message that's also important that I'd like to share, because it's one I've I have shared as a parent and a grandparent on the education pieces with young people or loved ones, when you're trying to prevent the misuse of prescription medications, make sure they understand at a young age that while medications can do wonderful things if used properly, they have a role, they also can backfire. And so only use them if they're from trusted adults, medical professionals, or parents or caregivers. Anything else, you're playing Russian roulette.
Thank you, Dale. All right, Sarah, your turn. We're good friends, and you can tell I have a problem.
Well, Peter, I think the first thing I would suggest is, as Dale and Janet alluded to, is really make sure that I tell you that I'm here to support you. I will walk with you through this journey, and we will do this together. And it's not necessarily going to be easy. You're not a bad person. This can happen to anybody, and we're seeing it happen to all classes of people, all types of people. So it's not that you're a bad person, but I want to make sure that I get you help so that you don't end up having issues in the long run and may even go to death. I want you around in my life. So I think right now we need to look for a treatment center. We can go to our local pharmacy if you're not willing to step into that treatment center right away, and make sure you have some naloxone available, the reversal agent for opioids, to make sure that you're safe at home. And then we will continue to work through finding a treatment center or provider to help you get off of this medication.
Now, we know that this is a lot easier sounding than it is, but I think we'd all agree that one of the most important things is that people recognize that this is a life and death situation, that as hard as it is to address somebody, because I sort of tried to figure out, how do I role play being an addict? And my best thought was, I don't want to listen to you. I don't want to hear you. I don't believe you. I don't have a problem. Mm-hmm. And maybe part of the message that I'm sensing from all of you is that with compassion, there has to be persistent. You have to realize that you're saving a life.
Persistence is absolutely required because relapse is a part of addiction. If you're not persistent in trying to get help for someone, then it's not going to work. It's just not going to happen in most cases. So somebody has to be their foot on the pedal.
Thank you very much for everything you have shared, and thank you for joining us today on Surviving Bad. Keep your eye on Mediacom MC22 for our next episode, where we explore Iowa's stories of survival, hope, and inspiration, and take a look at medically assisted treatment for opioid addiction. Only on Mediacom MC22, your local programming leader.